I want, first of all, to share, as it's been done by my colleagues, my privilege to be here for these last 2 days. In fact, when I was invited to this meeting months ago, I was really happy to come and to attend because, in fact, my first mission in '98 as an internal medicine trained doctor, I had to deal with a 150 beds capacity hospital tent full of under 5 being treated under IV quinine and blood transfusion. So I thought I decided to stop the Larian mefloquine malaria prophylaxis treatment, thinking this is what was preventing me to sleep, but in fact it didn't work. I keep on not sleeping during my whole mission, as I was just calculating doses all the time, continuously. So that's why I was so happy to be coming to the first MSF Pediatric Days. I thought those were excellent news. So I'm delighted to see all MSF, as you've mentioned. There's many sections, operational centers, and we are a network we are a bunch of people, and we make this together. So thank you for you making this happen in such a way that all MSF movement is coming together and gathering today here at international level to reflect on pediatric management. And I want to say that because it's been already mentioned, we are not talking about only pediatricians. We are not only talking about pediatric nurses. We are talking about how to empower the MSF medical teams to practice the best pediatric management we can and we should afford for our patients. So. More recently, they asked me to make the formal closure speech, and then I got in trouble. I was not that happy, as I was just minutes before. I was a little bit in trouble. Why? Because I'm not a very formal person, and I can say on behalf of MSF, we are not a formal organization. And I think that we are not. As a humanitarian medical organization, we are providing healthcare in difficult settings, and we cannot be that formal. What we are at is at providing efficient and at producing efficient medical actions and looking for solutions, medical solutions for our patients. This is where we are at. And as frontline and first-line healthcare workers, our medical practice has to adapt and adjust to the environment, our patients, not us, our patients, because somebody says MSF settings, they are not ours. They are our people, I mean, our patients' environment. And this is it's not just a joke, it's a real reflection, because I think it really changes the approach. So I think that's the real issue, and this is where everything is at stakes. We are talking about lives, and we are talking about survival, as when we practice medicine here in this hospital. It's just that the level, I would say, and the intensity of the disaster situations MSF teams are confronted to, where we are to provide medical care very often very alone with national medical teams is the real challenge. So as I say, what we try, it is all about, not only about practicing best medicine, but to do it under exceptionally challenging circumstances, given the very complex settings the patients are going through. And I summarize this, and please don't take me wrong, it is about providing the most humanitarian medicine, and not to provide what I call low-cost medicine. And again, please do not misunderstand what I say, but MSF medical teams are really, this is the core activity of MSF, is to be confronted to these dilemmas and to have to choose operationally on our medical strategies to respond to the situation our patients are going through. So this is the game, and this is the challenge, and this is why we are discussing here. I think you've seen how easily MSF people jump into discussion, and how open we are to criticism, not only external, that we appreciate and that we need, that's for sure, but even internally, we enjoy those criticisms, and I'm serious about that because this is what has been moving us forward, and I believe this is what has given today to MSF. I would say a very specific added value when being on the field and when talking about medicine and how to provide it, talking about humanitarian medicine in the context we are mentioning, and I truly believe these days, for instance, are a good example of how we go through lessons learned exercises, and even though we might look like having a short memory, in fact, there's a lot of energy and there's a lot of progress in that sense, and there's a lot of expertise and know-how in that regard. So just to give you my very, I'm really very impressed about on the very inspiring presentations that have been given here. There's a real field approach, which is very much welcomed, and I believe that all what is being mentioned as very important in terms of how caregivers are part of it, and how they, I mean, the mother-baby units and the couple. I think a colleague from here, from Karolinski Hospital, was speaking about the couple treatment and case management for mother and babies. I think that's that type of innovative and creative models of care are the real way forward. And by the way, as I'm a sort of adult doctors, I also believe within MSF that we have to learn from that type models, different models of cares and approach, because regarding highly insecure context, if we could establish the same therapeutic alliance and relationships with adult patients, I believe that would be a good modus operandi when we have very difficult access to patients, how to share that responsibility for the management and how best we could come along. So that's an operational important element. I think I have to go towards just to highlight extremely important topics that had been put on the table, and antimicrobial resistance. I am an infectious diseases physician, so you can imagine that I'm a little bit concerned about it. I truly believe, besides what it's been mentioned by my colleagues here, I truly believe. In fact, you know, on the 23rd, during the United Nations General Assembly, for the fourth time in history, AMR has been discussed at the highest level. And Joanne, our president, was producing a statement from MSF on behalf of MSF. So just to say that I'm participating on behalf of MSF to many global health landscape discussions on the AMR. And I truly believe that there's something MSF can do, which is to center the discussion on our patients. I think there are two advantages to that. One is for the sake of our patients. I think everybody knows that if I diagnose better the resistant infection in my patient, his outcome is going to be different, obviously. And if I help my patient and I treat efficiently my patients, I would be as well benefiting the community, and from that to the global village. It's just that some of the global health approaches to AMR are, I do have a lot of respect for them. It's just that they're difficult to translate into action, and in fact, I say it's a little bit lost in translation. It's like a nebulous, a little bit lost in translation. So I propose that, and I believe it's really this the way forward, in such a way that we tailor the interventions towards our patient case management, and therefore towards the community, and from that you can go upwards and not the other way around. That's somehow a proposal. I cannot stress enough how you've seen the figures. MSF provides more than 8 million OPD consultations. You know, there's a lot of pediatric age groups included into those consultations. I think that my colleagues have already talked about how the pediatrics management is not only about hospital setting, and it is going into the community, and I just like to highlight it. And then, also as a suggestion, I know you're aware of the major role that vaccination has played to decrease mortality in pediatrics, in children under 5. So I know very well that you are very much taking vaccination in your pediatric management approach, but just to insist and to emphasize on I was just saying I will not miss the opportunity to speak about vaccination, because we should not miss the opportunities to vaccinate beyond the approach of vaccination in emergencies that we all know, and where MSF, through with our colleagues in the MSF Access campaign, are really making progress, and we are getting there. So that's pretty good news, and I thought that the pediatric forum should clap for that somehow. And it's the same about the rotavirus vaccine clinical trial, with very promising results coming out shortly. So that's just to mention. I cannot leave without speaking about the situation in Nigeria, in Borno State. There's a huge unfolding catastrophe going on there, with thousands, with hundreds of thousands of people in many different locations absolutely trapped in a conflict area, military zone, where they have no access to food and medical care for many months already. We are witnessing, and we are assessing, and we are witnessing mortality rates which are like 3 to 4 times the emergency threshold, both for children under 5 and adults. We are seeing very, very cases. Just to give you a little bit of a hint, and the malnutrition rates are just quite difficult to believe, I would say. This is something that just reminds you that here we have quite a very nice, nevertheless, technical discussion, but in fact, you're working for that, for MSF medical teams to provide the best care they can to this population in dire need. And I think I've gone through my main notes, and I just want to say why the first MSF Pediatric Days had to happen. Well, it's been mentioned, almost 1/3 of the population MSF cares for are in pediatric age. And there's certainly a lack of equivalent forum dedicated to child health in humanitarian settings. I would say in humanitarian context, there's no real operational focus when attending, when looking at scientific gatherings. So I think MSF, this one is really, it's more than real-time PCR. I think it's real life on the field, and that's really very much welcome. So. I've seen that these days do nicely give MSF the opportunity to keep building medical operations, consistent ones, and with a strategic approach, inclusive of all the different MSF skills, I would say, mixing operations, mixing medical department support, and as well as the partner sections and the different métiers. As it's been mentioned already by colleagues here. So I hope I will not forget anybody when I say thank you very much to, of course, MSF Sweden for boosting and hosting this event, which is a very successful one. I would like to thank you, the medical directors in the different OCs who are being extremely supportive to this for this gathering, as well as the Pediatrics International Working Group for all the engagement. I want to thank you, the scientific committee that has pilot and help out at identifying the priority topics to be discussed for the first MSF Pediatric Days. And I want as well to very specifically thank the Karolinska University on their full collaboration for this event to happen, and the support, including this wonderful conference room we've benefited from during this day. So I'm looking forward to meeting you again in an MSF Pediatrics Day. And what to say, long life to the newborn MSF Pediatrics Day. Thank you.